Good afternoon, everyone, and welcome to today's webinar, Continuum of Care, an effective framework for youth safety, accountability, and justice, hosted by the Office of Juvenile Justice and Delinquency Prevention. We have a variety of distinguished speakers today that will get us through the next hour. First, starting off with Liz Ryan, the administrator of OJJDP, is going to provide some welcoming remarks, followed by Cheryl Jones, deputy administrator within OJJDP. Following that will be Janet Chiancone, the Deputy Administrator as well with the OJJDP. Then rounding out will be Scott Pestridge, Senior Program Manager with the OJJDP, to talk more of the specifics on this opportunity. So at this time, it's my distinct pleasure to introduce Liz Ryan, Administrator with OJJDP, for some welcoming remarks and to begin the presentation. Administrator Ryan.
Good afternoon. I'm Liz Ryan, Administrator of the Office of Juvenile Justice and Delinquency Prevention, or OJJDP. Welcome, and thank you for joining us for today's webinar. We'll be discussing OJJDP's Continuum of Care framework and how your community can adopt this approach to youth justice and hone your responses to emerging community needs. In a few minutes, I'll pass the microphone to my colleagues, Cheryl Jones, Janet Chiancone, and Scott Pestridge, who will discuss how to create and implement meaningful, effective continuums of care. But first, I'd like to give you a little bit of background on OJJDP, our Continuum of Care framework, and our Building Local Continuums of Care to Support Youth Success initiative. OJJDP is a federal grant-making office within the Department of Justice's Office of Justice Programs. For 50 years, OJJDP has been the only federal office solely dedicated to serving youth who are involved in or at risk of becoming involved in the juvenile justice system. We provide national leadership, resources, and funding to states, tribes, and communities to protect children, prevent delinquency, and transform the juvenile justice system. Decades of research and success in other fields support continuums of care, including its use in the housing and healthcare sectors. However, some of you may be unfamiliar with the term continuums of care in the context of youth justice work. Simply put, OJJDP's Continuum of Care framework emphasizes evidence-based and promising programs and practices to ensure young people can access needed resources and services where they live and at every point in the juvenile justice system. We developed our Continuum of Care framework after holding numerous listening sessions and town halls around the country. Scores of youth justice stakeholders attended, including young people and families who have firsthand experience with the juvenile justice system. We listened as they shared their thoughts on what does and does not work in youth justice and why. Their input informs all the work of OJJDP. Our Continuum of Care takes a holistic approach that prioritizes community safety, centering the needs of youth, families, and communities, and recognizing the dynamic nature of those needs. For the vast majority of young people, it emphasizes prevention and early intervention services, supporting youth who are at risk for both delinquency and victimization. For young people at high risk of moving deeper into the juvenile justice system, the framework emphasizes intensive, targeted, evidence-based programming. These prevention, intervention, and reentry strategies address youth needs comprehensively while promoting community safety. Implementing continuums of care makes sense at both the federal and local levels. Communities are better able to assess their needs, identify gaps in programs and services, and distribute resources accordingly. The goal is to prevent most youth from ever entering the juvenile justice system and to help those who become system involved to find positive paths for the future. OJJDP's Continuum of Care also fulfills a new provision in the 2018 Juvenile Justice Reform Act that directs OJJDP to support a continuum of evidence-based or promising programs that are trauma-informed, reflect the science of adolescent development, and meet the needs of youth who are involved in the juvenile justice system or who are at risk of system involvement. In fiscal year 2023, OJJDP launched the Building Local Continuums of Care to Support Youth Success grant initiative. In its first year, we awarded $17.1 million to 26 grantees, including 6 states, 17 local jurisdictions, and 3 training and technical assistance providers. These grantees are implementing extraordinary plans to advance OJJDP's goals and strengthen continuums of care in their areas. We anticipate awarding more than $7 million in fiscal year 2024 under this initiative as well. Now I'd like to introduce my colleague, Cheryl Jones, who will speak in more detail about what the continuum of care means for OJJDP.
Thank you, Liz. Appreciate that really great context that you laid out about the office and our continuous care work. So what will we be covering today? As Liz mentioned, we'll be covering the continuum of care framework. We'll be talking about how that continuum of care works within OJJDP and then youth justice. And then Janet, my colleague, is going to talk about how a continuum of care works in the youth justice system. And then finally, Scott Pestridge will talk about OJJDP's relatively new initiative, Building Local Continuums of Care to Support Youth Services. Next slide. So this is a graphic. Hopefully you all can see this clearly. You might want to enlarge your screen a little bit. And as Liz said, we've adopted, as OJJDP, we've adopted the National Continuum of Care Framework for Youth Justice here at OJJDP. And this is a model that we're applying to our own work at OJJDP, as well as using it as a framework for communities serving justice-involved youth. And as you can see on the graphic, the continuum of care spans prevention, intervention, and reentry strategies. These strategies address the needs of youth holistically, wherever they may be along the continuum. Next slide. So what is it? What is this continuum of care? It's not really anything different than what OJJDP and the youth justice field has always encouraged. The continuum of care is a framework that reflects good juvenile justice practices and programming. A continuum of care represents a community-level system of supports and services that are responsive to the needs of individual youth and families, as well as to the larger community's goals of public safety and accountability. Communities that have a well-designed and implemented continuum of care have a strong prevention infrastructure, and they intentionally intervene early with youth at risk and when they get into trouble. The continuum of care allows for a variety of adolescent diversion and informal interventions to prevent youth from getting deeper involved in a formal system. However, when needed, the community can immediately respond with intensive programming and supervision for high need and complex youth, including those that need out-of-home placement and during their reintegration back home into their community. Next slide. So the idea of a continuum of care it's not new. It's been used by many other fields, as Liz mentioned, housing, healthcare, and others. In earlier years, these efforts may have been called something different, but at the heart, the processes behind it have always existed. Since the advent of the first juvenile court in 1899, up to the latest reauthorization of the Juvenile Justice and Delinquency Prevention Act. The youth justice field has always recognized a need for a continuum of services. We know many states and communities are already using this model. Now I'm going to turn it over to Janet, who's going to walk through I'm going to call it COC, the COC framework, and also highlight why OJJDP is using this model. Thank you.
Great. Thanks a lot, Cheryl. So we have, again, the graphic back up on the screen, and I'm just going to take a few minutes to walk through the graphic that we've been using. There are also in the chat is a link to a more in-depth document that has descriptions. But you know, let me first say that the graphic as we see it, this is how OJJDP decided to organize the Continuum of Care framework. There are different, there are many communities doing this, other systems doing this work, and it may be organized a little bit differently. but the general concept is the same, and I'm going to walk through each section. So we start under the green slice of the pie, as it were, with prevention. And those generally are those programs that reduce risk and produce and promote the protective factors for both delinquency and victimization, things like mentoring, arts, recreation programs, and some of the work that we do supporting children who are exposed to violence. Next, we get into the blue area, which is really our intervention area. And this also kind of runs the spectrum from low to high. The idea of intervention is meeting youth where they are, matching the program and response to their level of need. A low level of intervention under this framework is really about disrupting any kind of formal involvement in the system. So diverting youth prior to arrest, doing some mediation. Some of these are school-based programs often, or in the child welfare system. A medium level of intervention, again, are often supporting youth that are maybe formally referred to the court system or some kind of court process, and often involves some kind of a specialized service and program. Some of our treatment courts could fall under here, for example, and some restorative justice work that is also done in this area. And then higher end intervention typically are programs that are providing some level of intensive supervision for high-risk youth, and often those that are adjudicated and may be also even on probation. Could include wraparound services. A lot of times it may include some kind of specialized education or therapeutic, targeted therapeutic program, cognitive behavioral therapy, and so on. The orange slice really focuses on out-of-home placement. These are placements that support youth when they're out of home, and these are often the reason for youth coming out of home, being placed out of home, is because there is a serious risk to safety. Often these are therapeutic foster care placements, group homes, non-secure placements, but also secure placements. And the dark orange really should be reflecting the population of youth that are going into locked facilities. So it's a very small number, ideally. The pink or rose-colored part of the circle is reintegration, what we often call aftercare or reentry. And these are those services needed to support youth when they return home: employment, housing, training, education, partnering with local volunteer and service organizations, as well as family support. It's important, obviously, at the community level to partner with many stakeholders, such as many of you who are on this call today, at both the state and local levels, because that is the best way to support a continuum of care for youth. We can move to the next slide, please. Liz mentioned this during her opening remarks. A major reason that OJJDP has formally adopted this continuum of care is because of our authorizing legislation, the Juvenile Justice and Delinquency Prevention Act. It was reauthorized in 2018, and in that reauthorization, it specifically called out the need for a continuum of services across the full spectrum of youth justice and safety, and that language is here highlighted on this slide. Next slide, please. Another big reason that the youth justice field and OJJDP specifically has recognized this need for a continuum early on was because of the strong foundation of research that's out there. There is a lot of research that exists regarding what works and also what does not work when it comes to delinquency prevention. Over the past 30 years, the research has shown that prevention continues to be a sound investment, and that the further a youth progresses into the justice system, the worse their outcomes are. Also, when we compare community-based alternatives to confinement, we also know that youth outcomes are actually higher in recidivism when it comes to locked confinement. Right now, the youth justice system also spends most of our resources in the most expensive and the least effective parts of our system, which is out-of-home placement. And that actually should be impacting the fewest number of youth, but the cost is very great, both financial and at the individual level. Something else that I think really calls to us to support this continuum, it has to do with the youth crime numbers and also the perception of youth crime. While the youth crime numbers have not been increasing nationally, we do know that in some communities there are a small number of complex youth, very high need and high complex youth that need a high level of intervention and focused services. And without those services, their outcomes and community safety is at risk. A strong continuum of care will factor in the needs of those youth and provides intensive, targeted, evidence-based programming to intervene and redirect them. At the larger community level, obviously community safety is extremely important, and even one act of violence and one victim is too many. It's also important that citizens can feel safe and assured that their community is doing all it can to prevent and respond to crime and violence. And when a community has a continuum of care in place, it enables that larger community to continually assess the status and needs, and also to fill gaps and address emerging issues. It gives the community a much more flexible framework and adaptive process responding to demonstrated needs of specific community members or pieces of that community. And it also ensures a better spending of resources on solutions that have been shown to work. OJJDP believes that the continuum of care is really the best way to ensure that public safety is prioritized and that the limited funds that we have are spent in the most cost-effective way, but also ensuring that youth and families are receiving the right services and supports. Now I'm going to turn it over to Scott Pestridge, who's going to talk about OJJDP's Continuum of Care initiative, which includes both grant funding and training and technical assistance. Thanks.
Janet, I appreciate it. So I'm just going to talk for a few minutes about what we've done thus far as an office around this work. Daryl, if we can go to the next slide. So January of this year, we awarded over $17 million across 26 awards, as Liz mentioned earlier, to support this inaugural FY23 Local Continuums of Care to support Youth Success Awards. There were 23 site-based awards, 3 training and technical assistance provider awards. And so that was a very late cycle FY23 solicitation that ended up with the January 1, 24 start date. So we're well underway in terms of supporting those sites now. We also have a current solicitation that's going to be supporting up to an additional $7 million across 13 sites that will close on Wednesday in 2 days. I just want to mention on that particular solicitation, it was due to close today, but because of the CrowdStrike issue, we extended the ability to submit applications by 2 days, with the understanding that you have to have met the July 8th deadline in grants.gov to submit your intent to apply in order to be able to submit by this Wednesday. So I just want to, for those of you on this call that may have met that July 8th grants.gov deadline, you do have until 8:59 on Eastern time on Wednesday, the 24th, to submit your fully articulated application. These links are here provided. I know Daryl said that the NTAC is going to provide these slides to you all. This is last year's and this current year's solicitation, just for you to become familiar with it if you're not already. Okay, I just wanted to provide those documents. Next slide. So, the important thing to note here is that this is a planning and assessment initiative in FYs 23 and 24. It's really around coalescing partnerships and really building collaboration within communities to help identify how to be most responsive to youth that are at risk of entering the juvenile justice system while taking a informed and coordinated approach, and then convening stakeholders to engage in a planning process that will inform the development of the continuum. And I always like to just use an example, and I think that just kind of helps frame things nicely. The idea of many youth, they're not getting services until they're deep involved in the system. There are youth that maybe aren't getting behavioral health assessments or substance use disorder treatments until they're in secure detention, and maybe some for only the time that they're in detention. And that's just a little, just a little backwards. And so we want to figure out how to get those services at a more primary prevention, early intervention point, so that we're not providing these evidence-based services to youth when they're deeply involved. So the goal of this really is to promote decarceration and provide more opportunities so youth can really thrive at earlier stages. And so that's just a little nugget I like to throw out there to help understand the goal around getting systems to communicate and figure out ways to provide more proactive preventative responses and supports for youth that are that are high risk, engaging in risky behavior, starting to become system involved. So these awards I mentioned for FY23, they were made here in the beginning of this calendar year of 2024. And it really is a significant commitment that Administrator Ryan made to this program, over $17 million in FY23, over $7 million in FY24. And really it's to develop this continuum of care that includes this focus on positive youth development, prevention, diversion, and treatment services. And then the idea is also that information in the proposals that come in of what we're funding, it needs to have, documentation that identifies communities within a particular, if it's a state application, it needs to focus on, highest needs and readiness based on data that looks at juvenile arrests, diversion, juvenile detention. This idea of kind of acknowledging, if there is an over-reliance on utilization of detention, figuring out ways to really kind of harness that in a way to identify resources to address and kind of mitigate that. So, there's two categories of funding. There's the state planning and then the local planning sites. So, local is focused on a particular county, parish, city, and then the statewide effort is looking at a more systemic statewide campaign. And so we have in FY23 cohort, we have 6 statewide sites that are endeavoring in statewide reform efforts, and then 17 that are looking at local efforts. So next slide. So I just went over that. And we also have 3 training and technical assistance providers. We provided a robust training and technical assistance support for this continuum of care work because it does touch so many elements of work, that's really crosses many fields of professional work, and that requires multidisciplinary teams, just as the COC work within a community requires a multidisciplinary approach. We feel strongly that the training technical assistance also requires that multidisciplinary approach. So we modeled that by having 3 providers that are working, focusing, and we'll talk about those in a few minutes, but focusing on, specific elements, providing a specific sub cohort supports, but also working across the entirety of the initiative to be able to stand up best practices and resources that can be used to help promote continuums of care. So next slide. Oh, one other thing. So it is for the sites, it's an 18-month planning process. Our training and technical assistance providers are working on a 2-year time horizon to be able to glean best practices and garner resources to be able to populate information that can be utilized not only for the sites that we're supporting in planning and assessment, but also for the larger community to start thinking about ways to build out their local continuums of care. So for the FY24, the anticipated awards for which the solicitation closes on Wednesday that I mentioned earlier, we're looking to fund up to 5 state planning agencies and up to 8 local planning and assessment sites. So, of course, for the state planning agencies, the funding's, a little heavier. It's up to 800,000, and for the local planning sites, it's at up to 425,000 per site, and that's over the course of the 18-month planning and assessment period. What I find really exciting about a planning and assessment period is it really allows communities to challenge themselves around, okay, what can we do a little more intentionally to really start breaking down these silos? And we have some really interesting strategies that are taking shape, throughout the nation. So many that are looking generally at continuums of care, and some that are focusing on the specific elements, whether it be mental health or housing insecurity. And so I find it to be really intriguing, and I think we're going to get a lot of great resources as we move forward in this initiative and building out our resources for the field. Next slide. So this is our list of FY23 planning and assessment sites. You'll see the 6 state sites that were selected, and then the local sites. I know District of Columbia is its own jurisdiction, but it was funded under the local site category. And then you'll just see there's just a plethora of counties, some that are connected more in mental health streams, some that are public health commission, some that are in the courts. So it's really, what I also love about this initiative is that you can be at one particular entry point into the whole system, and be that champion for the larger world of connectivity, right? So, for example, we look at the judicial courts of state of Illinois and Cook County. They're like, hey, we really have, we can do a better job around making these connections, and we really want to make that happen. And we're willing to convene this multidisciplinary stakeholder group to make this connection happen. So they're kind of like being the ombudsman, if you will, of bringing on that charge. But they can't do it alone, nor can any of these organizations, which is the whole point of this continuum of care model. But what I love about it is that you can have a vision as an organization and build it out to build that solidarity and those partnerships across across the spectrum, to really be able to fully support youth that need, and families that need services. And I think that's really exciting. So this is our list of FY23 sites that we're currently supporting. And there are a couple of sites that you'll see that have a state agency that also has maybe a local initiative, like Philadelphia, is a local site, but they also have a state connection. So, I think one thing we'll be looking at is ways to kind of garner supports even across that state, implementing our planning and assessment site, the Pennsylvania Crime and Delinquency designated state agency, working with the city of Philadelphia in making those connects. And in fact, we had a big kickoff meeting a couple of months ago in Harrisburg, where both of those entities came together to kind of share their vision. So, we're really, really excited about continuing to build this work out. So next slide. Just real quickly, I'm just going to go over the overview of the program. It's, again, I think I've shared much of this. It's, to inform the development of this community-based continuum of promising and evidence-based prevention and intervention services. And, we say promising because, evidence-based, requires a lot of money and resources to really do. So promising is something that we're looking at, something that communities are saying, hey, look, this is working for us. Integrating that strategy into their continuum is, something that is an opportunity here. But the whole idea of this is providing this foundational support to keep youth from entering the system, diverting them from moving deeper into the system, and providing them ultimately with the skills they need to lead productive, safe, healthy, and law-abiding lives so that they can thrive as individuals. I mean, that's really the the ultimate goal. And I think anyone would agree that we would like to see that in our communities for our nation's youth and their families. So if we go to the next slide, overall objective is to identify these resources and also the gaps. So it's like looking at a gap analysis of what are the gaps that need to be filled in prevention and intervention services for youth at risk of involvement or already involved in the JJ system. So it's really looking at what are those gaps and how can we address and fill those gaps. And so the goal really is post planning and assessment, we'll be able to use what comes out of this to potentially support some sort of implementation work within a particular community. But we all know that you can't implement without fully understanding the data, the gaps, the needs for improvement within a particular jurisdiction. And that's also what I love about this initiative is that it doesn't promote a particular modality of like, oh, we must do this. Yeah, we must provide the best possible supports for our nation's youth in a way that doesn't have an over reliance on incarceration, that focuses on youth and family needs and integration of those voices into the supports that they need, but that it's not like, it's an opportunity to engage about really what are these pain points, if you will, around providing these fully integrated services for youth and their families, and then addressing, like really identifying those so you can say, okay, so what do we do about it? And I think that's a really exciting opportunity. And you can see like a ton of organizations, whether they be courts, public health commissions, designated state agencies, are taking it upon themselves to say, okay, let's look at this deeper. And, as Janet and Cheryl said previously, this is not something new in the sense of, OJJDP is always focused on collaborative approaches, but this is really an intentional, let's community-led, take a look at your gaps and resources and needs so that you can figure out how to more intentionally provide services at the earlier end in the continuum wheel. Prevention, early intervention, not deep involvement. So next slide. So, some of the specific program objectives is like identifying these strategies to support promising and evidence-based approaches that advance long-term well-being and success of youth and their families. And I think that, that's a pretty exciting objective to behold, to develop these economic impact strategies that result in cost savings and identify how these cost savings can be reinvested into the larger continuum of care. And I think this is an important one to note because while, many may say, well, this, really connecting a youth and their family and providing better supports, it's worth it on its own. Certainly, I would agree. However, I do think that there's a salient talking point to the idea of looking at providing more intentional supports at the prevention early intervention realm can really result in reduced costs and cost outputs to communities, counties, states, and could result in the cost savings. And that can really convey across a wide spectrum of interested parties to understand, like, wow, okay, this makes sense. SENSE and CENTS. It can make both. And so I do think it's an important thing to note. And to establish a sustainable framework that supports the decarceration of youth and the diversion of children identified as being at risk of involvement in the criminal justice system through this coordinated, collaborated strategy that also promotes safe communities. I will say that, some communities may have already some existing modalities around, connection points, and hopefully they do, most do, in terms of communication and kind of figuring out how to move forward and how to connect with one another. But the neat thing about this initiative is that really is challenging people to say, okay, what could we be doing better, and in a way that is, it's not accusatory. It's about like what, how do we make the system more functional, and that's a little bit about that. Next slide. So a couple of things that are noteworthy elements of the framework is, so our solicitation in the planning and assessment solicitations that we've put out in fiscal years 23 and fiscal year 24, requires that 100% full-time equivalent continuum of care coordinator serve as a facilitator and project director. And this is important because this is not easy work. It requires a lot of coordination naturally and effort in order to really be able to make these intentional connects and to have that full-time support that's provided through through the funding that we've offered in this planning and assessment award really does create opportunities for conversations that I wouldn't say otherwise wouldn't exist, but that otherwise wouldn't maybe have the level of support. I mean, let's be realistic. I mean, to have dedicated funding to support an individual to really make these connections can be a real game changer for communities in terms of moving forward with identifying gaps and really starting to fill those gaps. And then, so this planning council is really this multidisciplinary team of, community-based business, law enforcement, JJ, school, court services, social services, health and mental health providers, advocacy groups, and other public and private community and faith-based organization to really build out and assess the problems and costs the community incurs as a result of crime committed by youth. And so it's a a neat opportunity to really, I think, also inform all of those subcomponents that make up a community of what's being done, because I think so many communities are doing so many things that aren't fully understood or communicated across and within their communities. So this is an opportunity to really help support that cross fertilization of knowledge across multiple system providers. And again, I mentioned it's an 18-month planning process. Next slide. So I just want to talk for a few minutes about our training and technical assistance. So we're providing training in TTA is what I'll refer to it as, in areas of mapping community assets, identifying gaps in services, planning for achieving cost savings, and delivering and sustaining a community-based continuum of care. And disseminating these cutting-edge research tools and resources focused on best practices for prevention, early intervention, and diversion programs aimed at reducing youth incarceration, and also developing tools, resources, and best practice information and guidelines on developing and sustaining a community-based continuum of care. Of course, some of these things are a little bit more, like as we develop these resources, we're working on standing up a website to really provide a platform for these resources, and that's something that'll be developed and populated in the near term to really help communities move forward. Next slide. Just want to highlight briefly the 3 training and technical assistance providers that were competitively awarded in fiscal years 23 to support our training in TA. And it's a real testament to our administration's commitment to this work that we actually have 3 providers, because initially, we had slated to have 1 provider, but when we really started to think about how this continuum works and interfaces, we felt it compelling to look at providing supports across multiple providers. So the Institute for Intergovernmental Research is one of our providers, and they really have a lot of knowledge base around building collaborative community-based service networks in terms of youth violence prevention work, so that's one of our providers. JBS International is another that has a specialization in mental health and victim service supports. Has worked with our Office of the Victims of Crime on some pretty hefty supports for victim services and mental health supports. And then the National Institute for Criminal Justice Reform is our 3rd TTA provider that's really focusing on transforming the juvenile and criminal justice system. So these 3 providers are kind of the 3-legged stool of our TTA, and they're working closely with each of the sites to provide specialized services across the spectrum of local sites, but also, kind of being a sponsor, if you will, to a third of each of these. Are focusing on leading TA within a third of each of the sites funded, so that there can be touch points, and so we're really continuing to work with the providers. With OJJDP connectivity, as well as with the sites, in terms of making sure that we're really maximizing engagement and providing the best supports that we can for those sites. If we just go to the next slide real quick, I'll just show, just provided a couple of slides on Institute for Intergovernmental Research. They have over 45 years of TTA, more than 25 focused on comprehensive approaches to support youth families and communities. And so they offer a lot of resources and assessment and planning already. So they're integrating those tools into the supports around the continuum of care work. And really have a good approach on collaborative brainstorming and evidence-based and informed practices to build sustainable initiatives. Next slide. So JBS International is a health outcomes company that really is more, like public health model primary, which continuum of care really is along the public health model. And they have provided a ton of supports on delivering health outcomes that support projects within OJP and OJJDP, and have specialized training in TA around communications, program evaluation, and information technology. And they've worked with some of our more rural communities, so they're paired with some of those communities, specifically around some of the opioid affected communities, because of the work that they've done in some of that public health connected work there. Next slide. And then the National Institute of Criminal Justice Reform is working to reduce violence and transform the JJ and criminal justice system. And really this is about increasing capacity and expertise of organizations that serve those individuals. So there's I think with all three of these organizations, we have the ability to really dig deep. They're working really well together as providers, but dig deep to really kind of focus on how to really exemplify and maximize services to the local communities that applied for the funding and that are current cohorts, but also to start building out these resources that can be used by many of you on this call that have an interest in starting to stand up a continuum of care within your community. Next slide. So this just talks a little more about NICGR's juvenile justice work. And, one thing you might notice, they have this neighborhood opportunity and accountability board, which is a pretty innovative model that takes youth out of the formal justice system involvement at the point of arrest. So a diversion program for certain. And focuses on restorative rather than punitive practices. So, I would say that, this is really the goal of what we're focusing on, is figuring out how to provide diversionary opportunities that are informed by needs of youth and families to gain their, to gain their composure, to be able to be fully productive and supported citizens. I mean, and I think that that's the goal, and that's what we're striving for. Next slide. So just a couple of things on next steps and upcoming resources. So we are working with the providers, the TTA providers, to develop a landing page for the resources. So that's something that'll be stood up in the next, in the near term, in the not too distant future. Another thing to note is that our national conference, OJJDP's national conference, which is slated for November 19 to 21 of this year, is utilizing the continuum of care as a framework for the conference sessions. And it's going to allow an excellent opportunity to engage with continuum of care across a broad array of youth programs and services. So I wanted to mention that as a touch point. And then, we do plan, it's in our program plan to issue a COC solicitation in FY25 as part of our continued commitment to meet needs of youth and families. So I just encourage you to, if you haven't already, to go to www.ojjdp.gov, click on JuveJust, sign up if you haven't already, so that you can receive funding announcements as they're made available, because that's what's going to allow you to get, as soon as an announcement's made available, it'll come to your inbox and you can begin the application process. So please do that if you haven't already. Next slide. So a couple of good resources around our various social media. There's a nice little URL there, like a QR code, I think is what we call it. I'm still learning that you can click on to gain access to our website. And again, it's www.ojjdp.gov. And with that, Daryl, I don't know if you have housekeeping items to do, or if I should just continue with, asking about questions.
Yeah, I mean, you can continue on. Just for reference, there's been a couple questions about the slide deck, and yes, the slides and the recording for today will be posted to OJJDP's website. So keep an eye out for that. Everybody that registered will receive an email when those are posted. So
Great. Thank you, Daryl. So I think we have like 10 minutes remaining, and I invite the other panelists to come on screen if possible, and maybe we can, if we have questions, let's do we have any questions in the chat, Daryl?
I see a question. I can, one of the questions that was in the chat during your remarks, Scott, is a question from somebody asking if there's a way to find out if or how a certain county might already be working on this. So, how could one find out whether their local community, I think, is already working on this? In this case, they're interested in Sacramento, California. But I guess I'll start, and Scott and Cheryl, please jump in. I think your best resource is to go to any local agency that you think would be involved in this continuum. And in most cases, it's probably going to be your juvenile justice or child welfare agency. There are many communities that do have sort of planning commissions or something like that around these topic areas. They would most likely be the entity that's working on it. But let me also ask Scott or Cheryl if they have anything to add to that.
No, you want to go ahead?
I just want to say, so, in terms of, when I think of, I'm very literal. So when I hear currently working on, like, they're not in Sacramento is not one of the local sites funded under our FY23, solicitation. But yeah, I think Janet's correct. I think that the fact that you're interested in seeing what's currently in place within your community is exciting. And, I would encourage you to explore that with some of those resources that Janet stood up. And if you find that there's maybe not as much that there's more that you'd like to see in terms of interface, then that really could be an opportunity for you to really start building out your local continuum and thinking about ways to really start standing up an initiative like this within your community. So I think it's exciting, and I think it's also a pretty common question, just like what currently exists, in my community, and so I think it's a great opportunity to engage, to see, and start having the conversation. Likely, there's going to be some sort of interface, but I don't think that this language is necessarily as broadly embraced as you would think in the juvenile justice world. I'm not sure that we've seen a ton of people talking about this type of, in this nomenclature, continuum of care, and connecting resources in the way that we're discussing. So I think that it is a little bit on the cusp of newness. So I wouldn't be surprised if you found limited engagement, but I could be wrong.
And I just had a thought, Scott and Janet. Maybe it would be helpful on the OJJDP website. You can see all of our active grants across, whether we're talking continuum of care grantees, drug court grantees, delinquency prevention grantees. So if you go to the OJJDP website, and I'll find it and put it in the chat group. There's a map that shows all active awards with OJJDP. And there's even one for all of OJP, so all of our sister agencies. So I will put that into the chat group just in case you want to see what else is maybe happening from our office in your community.
That's great. Scott, I think this question is probably best for you. There is a question, are nonprofits able to apply for these types of funding? And I think specifically if you can answer for this continuum of care solicitation, OJJDP does have a number of different funding opportunities, but I was going to ask Scott to respond specifically to this one.
Sure. So nonprofits are not eligible under the current, like the current solicitation that's open right now that's closing on Wednesday around state agency and local planning and assessment sites. It's really state governments, special district governments, city or township governments, or county governments. I will say that last year, when we initially put out this solicitation with 3 categories, we had a state agency, a local agency, there's planning and assessment, and then a category 3 training and technical assistance. Last year, under that category 3 training and TA, nonprofits and for-profit organizations were eligible to apply for the training and TA category. So in the larger scheme of continuum of care, nonprofits were eligible for a particular category in fiscal years 23, but currently under the planning and assessment site-based awards, it's limited to governmental entities.
So there is also a question about the definition of continuum of care. I'm going to try to capture this. The question is it feasible for a single organization or entity to design a series of programs or initiatives that constitute a continuum of care? Or is the continuum of care by definition a series of separate organizations that work together to create a continuum? Scott, I'll let you take the first one.
I think that, no, that's great. Yeah, I think that, I think that while one entity can have a vision for how it all connects, I think that necessarily in order to properly fund and support a continuum across a multiple, a pretty large swath of, prevention, early intervention, secure, the whole wheel that Janet and Cheryl kind of promoted earlier. It requires a concerted effort across multiple disciplines. And so while I think that you could have a thought leader that kind of helps pull it all together, this cannot be a one organizational approach, because I just don't see how that would would result in a true continuum. I don't know. Janet?
Yeah, I totally agree there. And I think part of this too is about the long term and also the funding, right? So because, it's the big part of the continuum that we all feel, that the individual youth and families and community members experience are the services that come from a variety of different organizations. But it kind of goes back to this idea of this being a long-term effort, that the continuum is going to shift over time. The needs of the community change over time, and the funding sources, frankly, right? We all know, right, as things change over the years, different initiatives, different funding sources. The great thing about a continuum that is funded by a different variety of sources and also provides a variety of different programs is that it is responsive to the community, but it is also able to react to those funding opportunities. And ideally, as the continuum progresses, the funds are better invested, right? You're putting money into things that we know work, and you're focusing much more on prevention over the long term. So I agree definitely with what Scott said, but I think it's also, it's beyond even just the services. It's kind of the way, as a community, we operate.
Great. Looks like there's a question about education in here as well. Are you tracking that one, Janet?
Yes, and that had to do, I think this is about how is it best to kind of come back, bring in, educational services into this continuum. And I think it is that making that connection at your local level, who is the entity that would be sort of the thought leader in the continuum, or who is the coordinator of those services? Because ideally, again, it gets back to the resources. Where are resources being spent? Are they being spent on incarceration, or are they being spent on some of these early intervention or even deep intervention services like education, which is a key component, and educational support to getting youth kind of back into their communities and into a kind of successful path along the future. So I would definitely encourage you to connect with your juvenile justice agency if you haven't already, and child welfare. Again, those are usually often the same population of youth, right, that we see, at least at maybe at different times on the continuum, but often seeing them, and making sure that that you make those connections basically at that level.
If I could just share one thing for Sarah. So I think it's a great question. And, we do have a lot of programs that really touch on the type of work that you're discussing. And I just put in the chat one example, which is this STOP funded Enhancing School Capacity to Address Youth Violence solicitation that we put out the last 3 fiscal years. And, it's really about the continuum of care. It's about connecting communities, identifying needs within their community around school climate, within the K-12 population, and then connecting community-based resources to the schools, partnering together to provide those resources, whether it be, interventions, after-school initiatives, behavioral health supports. It's a plethora of things that are community identified, but really bridging that gap of identified needs and then providing those resources. So I think that you could look at, I provided that solicitation as an example, but you can look at it. It's in our program plan again for next year, that particular solicitation. But, you might want to look at that as just as a way to maybe start addressing some of what you were talking about in this particular question.
That's great. Just 2 comments. I see Lisette Burton, thank you for that comment, and we will definitely take that advice. And then I know, Gladys, you had a question about the fact, well, you asked about OJJDP's guidance to states that often it's not the higher risk youth or highest need youth that are in out-of-home placement, but it's often very low risk youth. And that is actually one of the reasons the continuum of care really, really is important, because we know that placing youth who, who really are not a danger to community safety in detention and placement is bad for both the community and the individual youth as well as their families. That is not an evidence-based or promising practice. We believe that a community that implements a effective continuum of care would be doing very early prevention and early intervention with youth who are, really at the beginning of that continuum and who really do not need to go any further into the system, because the outcomes are so bad for those youth.
And I know we're at time. I think we should turn it back over to Daryl for whatever closing pieces he has.
Yes, thank you. Really nothing else to add. We want to thank everybody for joining today's webinar. And like I said, be on the lookout for a follow-up for direction on how to access the slides and the recording. So with that, on behalf of OJJDP and all of our panelists, we want to thank you for joining today's webinar. This one, today's presentation.